Hi, in this video I'm going to be talking about weakness during breast cancer and its treatment. It's possible that you're going to feel less strong. So you're going to have more muscle fatigue and it'll be harder for you to do things like climb stairs. This can be really upsetting to people. So I'm going to talk about what causes it, what you should do, and other things to think about. If you want to learn more about your treatment options and what might be offered to you, visit Yerbba.com. So weakness, a lot of people will describe themselves as feeling weak when really they're lacking energy. So I want to be really precise. Weakness means that our muscles are unable to do the job that they used to be able to do, and that of course we hope they are able to do again. So if you find that you're having difficulty getting up from a chair without using your arms, or you're having, when you're in bed, to roll on your side and sit up, not because of pain, but because you just don't have the muscle strength, that's the definition of weakness. It doesn't necessarily mean that there's a problem with your muscles. So we can have weakness due to anemia, which can be caused from surgery if you've had reconstruction and a substantial amount of blood loss during the operation. We can have weakness because we're not rested as well, or if you went into treatment deconditioned, meaning you weren't as fit, it doesn't take much for you to feel weaker. So what can you do about it? First thing is, if you're having difficulty getting up from a chair without using your arms, or you notice difficulty with raising your arms up to brush your hair, for example, or to do your makeup, or put on your scarf or your wig, it's really important you let your medical team know, because this is not a common side effect of any breast cancer treatments. There could be other things going on, and blood work might be appropriate in your case. For example, looking at phosphorus levels, potassium levels, and your kidney function. You just want to make sure everything is all right in terms of normal things that we check. So let your medical team know. It's also possible that you have another medical condition that treatment revealed. So you may have an underlying neurologic problem. I don't want to scare you, but you just don't want to assume it's due to the chemotherapy. If your muscles are weak and you're on chemotherapy, there are some chemotherapy medications that can cause neuromuscular problems. If you want, check out our video about peripheral neuropathy. The same medications that can cause numbness and pain in the fingertips and toes can also cause weakness in the muscles, especially what we call the proximal muscles. So the muscles that help you bend your hips and the muscles in the shoulder and back. Those are paclitaxel and docetaxel. We also see it with a medication called vinorelbine and some other chemotherapy medications that work on cells that are already dividing. As the cells divide, they kill the cancer, but these chemotherapy drugs can occasionally cause problems with weakness. And that we see not with a typical 4 cycles or 6 cycles, but more in people who are on these medications long-term for advanced breast cancer. It's important you let your team know, because once we become very weak, it's harder to get strong again. What can you do to get stronger? Well, first of all, be very kind to yourself. It takes a while to develop weakness. It's going to take a while to get better. If you're anemic, it's possible that it will be recommended that you take iron. Don't do this without talking with your medical team, however. You can get iron in your food. So as you know, meat, especially red meat, can help boost our iron levels, and a lot of vegetables, green leafy vegetables, have iron. But don't take supplements unless you talk with your medical team, because they can cause constipation. That's the last thing you need right now. The other thing you want to do is make sure you're rested. And then the third thing is exercise. And I know when we're feeling weak, the last thing we want to do is exercise. But the biggest problem is that when we're weak, if we don't use our muscles, they begin to atrophy. So the muscle fibers, which are usually nice and round and plump, get smaller. And that means you're going to be starting even further behind the starting line. So things you can do to get stronger are to straighten your leg when you're in bed and try to lock your knee, and then lift your leg up and raise it down. You can do that in the morning or at bedtime, or if you take an afternoon 20-minute nap. What you want to do again is lie on your back. You can be on the bed or on the floor, on a something soft to cushion your back. Straighten your leg. You want to lock the knee and then raise your leg up, and even till it's shaking a little bit. When people are in the hospital, I tell them when a commercial comes on, do that. Again, locking the knee is really important. The things that are very hard for you to do are the actual things you should do, but you can break them down. So if getting up from a chair without using your arms is hard, you can use a stool, and you just want to keep using those muscles. If you are not getting better, talk with your team, because a referral to rehabilitation is just the thing you need. They can teach you the exercises, get you into physical therapy so you don't lose more strength. I have covered a lot about weakness, what causes it, what it is not, which is just a general sense of fatigue, the different things that you can do to take care of yourself, and talk to your medical team about why it's important to talk to them, and then some exercises you can do at home. If this has been helpful to you, click like and subscribe. Drop a comment in the comments that we'll respond to. This helps other people find these videos, people who are going through the same thing you are, or somebody you love is going through.